So I'm going to record this for anyone to watch it later, and it'll be on a YouTube video, and I will send out the link to you guys afterwards as well. So we're going to talk about what vaccines are right for your horse, what people are giving here in Maryland, the Mid-Atlantic area. And let's see, my computer, right? So we're going to talk about the vaccination program, types of vaccines, and then I'm going to give you a little bit of a broad overview of a schedule that might work for your horse depending on discipline. So we're talking about a vaccination program. They always say not one, fits all. It kind of depends on a different variety of things. Is the disease prevalent in your area? Do you live near water where you're going to want that Potomac horse fever vaccine versus if you're living out in Kansas somewhere, you probably don't need that because you're not around a lot of water. You don't have mosquitoes to worry about. What's your horse's lifestyle? Is it a trail, do you just trail ride? Is it a pet? Are you showing every weekend, going around a lot of different horses? Are they racing? So they're under a lot of stress? They're in a confined area? Do you have a brood mare? They might need some protection against abortion. They're also under some stress. They're visiting other farms, probably to be bred about this time of the year. And then age, do you have a younger horse? Younger horses tend to be more susceptible to disease. Do you have an older horse that, like the strangles vaccine, that they might have had strangles before, they're older, you don't know, kind of weigh out your pros and cons with the different vaccines. So the AAEP, the American Association of Equine Practitioners, breaks up the vaccines in two different groups. So you have the core group and you have the risk-based vaccines. The core group on your left here, encephalitis, rabies, tetanus, West Nile, these are 4 vaccines that they say every single horse should always receive every year, no matter what, if they're just sitting in your backyard or they're actually, going places, traveling a lot. And then you have the risk-based vaccines when you're right here, that are kind of up to you and depend on that, like what we just talked about, their use, their age, and how comfortable you are with giving the different vaccines. And I'm going to go over all the core vaccines and then some of the risk-based vaccines that we in the Mid-Atlantic area tend to always give. There are some on here that we don't give just because they're not, it's not a prevalent thing in this area. Plus, a couple of them are for brood mares and stallions that are kind of probably not a little bit prevalent to you. But first, I want to talk about how do the vaccines actually work. So vaccines stimulate immunity by imitating an infection, but they don't actually make your horse sick. So we have, and so do they have 2 different blood types of blood cells, right? We have the red blood cells that carry our oxygen to the tissues and organs, and then you have white blood cells that fight infection. And so within those white blood cells, we have 3 that are disease fighting. The macrophages, which they kind of swallow and digest the germs, your kind of everyday germs. We have B lymphocytes that respond to any foreign antigens, which are the disease that's causing the organism causing the disease. And then you have the T lymphocytes that are stimulated by the antigens, and they attack and destroy the cells that have already been intact in the horse's body. So these horses are going to produce these T lymphocytes. When you give the vaccine, they're going to produce these and kind of come after it and kind of wondering what's, attacking our horse's immune system. And they're going to remember these antigens, and they're going to come back. So if your horse was ever sick again, it will have a memory cell. And so it'll be able to respond more quickly to fight off that bacteria or virus. Instead, if you had a horse that wasn't vaccinated properly and they became sick, it would take twice as long. So this is just basically, your first guard of defense. So I'm going to go into the core vaccines. The encephalitis is our first one. We have 3 different strains of it. We have the Eastern, the Western, and the Venezuelan. And when I say Eastern, I'm talking about east of Mississippi. That there's a strain that's more prevalent. There's one west of Mississippi, which is a milder form, and then there's one in South America. That's what we call the Venezuelan. It's also probably, you've heard it called sleeping sickness. It causes inflammation to the brain and neural tissues, so they kind of get a little bit neurologic. They get a fever, very lethargic, and it's transmitted from these mosquitoes. So it's kind of like West Nile. The disease is spread by mosquitoes that have kind of fed off those infected birds. So really, it's the birds that are the problem, and the mosquitoes happen to, bite that bird, and then they take it to you, or they take it to the horses. In most cases with this, your horses are probably not going to survive. 50% survive the Western and 90% the Eastern. So you definitely want to make sure, this is why it's a core vaccine that you want to vaccinate for every year. And so when we talk about, I'm going to give you a vaccine schedule for every vaccine that we talk about. The adults definitely want to give this in the springtime before the mosquito season starts up. So like now, because we're, it's going to get warm here momentarily. If you're living in the southern states, it might be earlier on in the year. If you have any brood mares, definitely 4 to 6 weeks prior to them foaling. And then foals, there's a 3-dose shots. So we have one at 4 to 6 months of age, then 4 to 6 weeks after the first dose, and then 10 to 12 months of age for the third. And this vaccine schedule is based on horses that have been previously vaccinated or foals that are born to vaccinated mares. So if you have a horse that has never been vaccinated ever before, or was born to an unvaccinated mare, there's a whole different series because you'll need booster shots. And the AAEP has a really wonderful chart on their website that you can look at if you have horses that in those categories. So rabies is our next one. You probably have heard about this. It's kind of prevalent in this area, whether it be, your horses had rabies, hopefully not, but raccoons, fox, they tend to be the more prevalent ones. Your cats, because they are out at night and they end up getting bit by whatever varmint is out there. Cats can tend to have rabies more often than not. But the symptoms are, inability to eat or drink, disoriented, neurologic. This also, because of the inflammation to the brain, death normally does occur 3 to 5 days after you notice this. So 100% need to have this vaccinated. The one thing about rabies is that some people, and like myself, I buy most of my vaccines by myself and give them to my horses. For the rabies, you should always get your vet to do it. That way, if there was anything to happen, as if your horse, was bit by something, you have proof to the state, because you're going to have to turn in information to the state of Maryland. So you'll have proof that your horses were vaccinated for rabies. Okay. We'll go next. Again, this is an annual shot. Brood mares 4 to 6 weeks prior to foaling. Foals only have 2 doses at 6 months, and then the 4 to 6 weeks after the first dose. Tetanus. So tetanus is a bacteria, Clostridium tetani, that you find in the soil. Horses or anyone that gets tetanus is typically because we had an open wound. And horses, they like to be dirty at all times. They probably rolled around, it became infected, and that's how they end up getting tetanus. You'll notice if they do have tetanus, because they no longer really can walk, they kind of become paralyzed, and kind of like this diagram down here, they're just stiff, They can't really move. They'll have lockjaw. They can't eat, and unfortunately, in most cases, do result in death. And with this vaccine schedule, obviously, every year, if you have a horse that ends up getting a puncture wound, I would always suggest getting a booster at the time of the injury. If your vet comes out to look at it, just get a booster just to be careful. Make sure that they don't get tetanus. Same brood mares, the foals, 4 to 6 weeks prior to foaling, and then again with the 3 doses for the foals. West Nile. Does everybody remember when West Nile became like a huge thing? The birds, mosquitoes. We unfortunately, I think, have a higher case here because we are so close to the water. We also have a lot of still water around here, right? We've got ponds and swamp. If you're on the lower shore, eastern shore, you kind of have those swampy areas, low-lying areas. We get a lot of mosquitoes that nest there. So mosquitoes will feed on the infected bird again, which then bites the horse, and then that's how they contract the West Nile virus. It is neurologic, and it kind of looks like the encephalitis. So that's why you'll see sometimes, and I do it, I buy combination vaccines. They'll have encephalitis, West Nile, and tetanus all in one shot because I know I need those 3. And then I think it's normally the Eastern that's in there. I also buy the Western separately. So just do them all 3 in a combination vaccine and then have your vet come out and do the rabies. You can treat West Nile with Banamine, Butte, get the fever down, and then antibiotics. But if they've reached that neurologic stage, there's normally no turning back. So that's why you need to definitely vaccinate. And West Nile, if you're in an area where the mosquitoes are really bad, I would suggest giving a booster in the fall, just to be on the safe side. So those are the 4 core vaccines that everyone must give their horses, should always give their horses. Now I'm going to talk about the risk-based vaccines. So these, like I said, they vary between your opinion, where you're located, what your horse is doing. And I'm going to only talk about 4 of them, mainly because the other ones we don't really, folks do give them. Like anthrax, we don't live in an area where anthrax is a huge problem. That's normally, Central and South America where anthrax thrives. It is extremely, has a very high mortality rate. It's extremely zoonotic to us. We know it's an issue, but we don't give that vaccine here. Botulism, I'm not going to talk about, but if you buy hay from, say, the hay market, the feedlot somewhere, you don't really know your dealer, I would probably suggest vaccinating for botulism. Mainly because that bacteria grows rapidly, decomposing animal tissues and sometimes in plant material if the hay wasn't cured right. So I used to vaccinate for botulism. We do our own hay, so I know, where it's coming from and who's doing what. So I'm not too concerned about it now, but if you have horses eating hay that you don't know where it's coming from, definitely. And foals they're more apt to getting it. And there's kind of 2 strains, like the shaker foal syndrome, which foals will get it when they're really tiny, they're like less than 4 weeks old. And then the other one is the wound botulism from the bacteria that's grown on the plant material. Another one I won't really go over is the EVA right here, the equine viral. Mainly because this is for if you have a breeding farm, this would be of your interest. But this is more often linked to the movement of contained frozen embryos and also frozen or chilled semen. So if you have a breeding farm, some stallions, you might want to vaccinate for this. Another one is lepto. Lepto is really big in dogs, mainly because it comes. So it's a bacteria found in the water from urine, and I had an experience. My dog actually ended up getting it probably 10 years ago, but um, because she swam in a pond all the time, and I guess something was in there and she drank it. Horses don't really, they're not really swimming much or drinking the water out of still water. Um, but it does cause uveitis, moon blindness, but there's only one vaccine that's available, and it's from Zoetis. Other one, rotavirus. This again, if you have a breeding farm, you'd be interested in this. But this is one of the most common causes of foal diarrhea. So if if you have brood mares and you're foaling out a bunch of mares, you'd be interested in the rotavirus. Herpes. So I'm sure you've all heard the big outbreaks that have been going on. Started, in Ocala not too long ago, a couple months ago, from horses shipping over, and then it's reached, Pennsylvania. It's been up in New Bolton. It's also been down at Laurel and Pimlico racetracks. But it really kind of shows its ugly head when horses are stressed. So, if you think about it, horses are stressed when they're living in a environment like such as a racetrack. They can be stressed because they're in confinement quite often. Um, in Ocala, horses were shipping over from the UK, so flying horses can be stressful. So a lot of horses have the virus in them, and it just is dormant, right? And then when they become stressed at any time, it can kind of show its ugly head and um, be a problem. So there's 5 strains of it, but we are vaccinating for 2 of them here, EHV1 and EHV4. The EHV1 has 4 different forms of that disease. So they have the respiratory, abortion, neonatal death, and then the neurologic form. The problem with EHV1 is that our vaccine only does the respiratory, abortion, neonatal death. It does not protect us from the neurologic form. So if it gets to that point, that's when we really have an issue. EHV4 is a non-fatal upper respiratory disease, and most commonly in foals. So it's not, it's a problem, but it's not a huge problem like EHV1 is. And this is really contagious because it's direct nose-to-nose contact. If your horse touches the water bucket and the next horse comes in and drinks off of it, or if your tack has their snot on it. So it really you need to use some really good biosecurity. If you know of a horse that's shipping in from an unknown place that's been stressed, really use your head and use some good biosecurity. Because there is no treatment, kind of have to just do some fever reducing meds, and hopefully it'll be okay. But up to 80% of horses are affected once they get EHV1. So the vaccine, it's an annual vaccine. I do a 6-month booster. At the racetrack, we have to do, I think it's every 3 months. So it's really, if you're showing a lot, out and about, you really want to stay on top of this, especially right now because it is so prevalent. Brood mares get a 3-dose series for it, and they get the one that's against the abortion, so 5 months, 7 months, and at 9 months of gestation. Foals get the regular 3 doses, so the 6 months, 6 weeks after, and then the 12 months of age. And I would even reconsider doing the 6-month, if you have a horse less than 5 years of age, so they're still pretty young, I would definitely do the semi-annual vaccine schedule. Or like I said, if you're out horse showing quite often. Equine influenza. So this is also highly contagious and spreads pretty rapidly. Again, just like the EHV, direct nose-to-nose contact, just anything touching equipment, brushes, rags, whatever. You'll notice that they'll get some nasty nasal discharge, just like us, right? Kind of get like this head cold, dry cough, a fever, feel like you just want to lay down and not do anything for a while. That is what they also get, the same symptoms. But their treatment is, anti-inflammatory, and rest for up to 4 to 6 weeks is what they kind of recommend. Really takes a lot out of them. So you really, if they get sick, quarantine them and take your time. Hopefully with your vaccine, you're not going to run into this issue. And this is also another one that I give semi-annually, if I'm horse showing and such, just to make sure. Brood mares get the 4 to 6 weeks prior to foaling. And then the foals, there's a modified live virus one that they administer intranasally. And the flu and strangles have is an intranasal vaccine as well. They say, and I'm going to talk about this a little bit later, they say, though, giving the intranasal one is more effective than it would be to give the intermuscular one. Another one I give around here is the Potomac horse fever, because of our water. It's a bacteria that's infected in these like snails and little aquatic insects. So it's a bacteria that affects these little guys. You can see in my diagram here. The flukes, the snails, the little insects. And so they're in here, and then the horse comes to, drink out of this creek, and by accident ingests one of these infected critters. And then now we have Potomac horse fever. But it kind of fever, colic, diarrhea also will cause abortion in mares, and laminitis. You can treat with this. It's not extreme, there's not a high mortality rate here. You'll treat with oxytetracycline, but some do end up being put down from secondary complications such as foundering. You can give this annually or semi-annually. I give it annually. Brood mares are to be given semi-annually, and then the dose, 4 to 6 weeks prior to foaling, and foals get 2 doses, one at 5 months, and then the second one 3 to 4 weeks after the first dose. Strangles, this was, I feel like it wasn't too long ago that strangles was running rampantly around boarding facilities. It's a bacteria that's transmitted, it's a bacterial infection of the respiratory tract. It's very contagious. Transmitted horse to horse by touching each other. Again, can also with your equipment, your saddles, buckets. This is why biosecurity is really important for, bacterial infections and viral infections. You'll notice if they are to get strangles, they get these abscesses under their jaw. They'll need to be lanced and drained. And then obviously these horses are to be on quarantine. But most horses do recover from this disease, but it's pretty nasty, very painful. You'll want to, if you're horse showing, doing much with your horses, you'll want to do this twice a year again. Brood mares annually, foals get the 3 doses of the killed vaccine, the same time frame as all the others, 6 months, 6 weeks after, and then 6 weeks after the 3rd dose. So those are the vaccines that we, in this Mid-Atlantic region, for adult horses, we typically give every year, and then some in the boost, in the fall as well. They do have, like I said, there's intranasal and intramuscular vaccines. There are 3 intranasal vaccines right now. I think intranasals are good because they have a better protective barrier for these needs, for the disease. Say that you forgot that you were gonna horse show or go wherever, in a week and a half, and you did not give the flu or strangles, you're going to want to do the intranasal because it's going to give you a better protection faster than it would be for the intramuscular vaccines. So we have, these are the 3 vaccines that are available intranasally. I get my vet to do these. I'm sure you could buy them. I wouldn't trust myself. So your vet would be your best bet. So for the flu, the Merck makes one, Strangles Zoetis makes one, and then the EHV 1 and 4. It's a different. I think it's a modified live virus. So it's the killed vaccine. Sorry, I'm sorry. These 2 are the modified live viruses, and this is a killed vaccine that's intranasal. I would just do the intramuscular vaccine for the EHV 1 and 4, but that would be, these are the 3 that are available. And so before we go anywhere, I made this chart up, and obviously you always want to consult with your veterinarian before, giving any vaccine. If you have any questions about any of it, call your vet. They can guide you in the right direction. But if you have, trail riding, pet, don't really do too much, older horse, retired, you could give all of these vaccines. I would probably not give the herpes vaccine or the strangles because they're not going anywhere and they're not seeing any other horses. Now, if this is a horse that lives in a field with your friend's horse who goes places all the time, I might consider it just because I'd be afraid for them to bring back the herpes or strangles. If you're showing, competing, give them all of them, especially the flu semi-annually. Racing, same thing, except for the herpes virus, you're going to want to give that every 3 months. And same for the broodmares. So they also have that EHV that is against abortion. I think it's called pneumoport. And you'll want to give that vaccine as well. Foals, same thing, but you don't have to do the Potomac horse fever for them. So I know that was a lot to digest in kind of a short amount of time. And you can always, these are 2 really good resources to look up. They break down all the different diseases that you can ever imagine. So the AAEP and then the Merck Vet Manual are really good resources to look at. But does anyone have any questions?
You mentioned one of them. You mentioned moon blindness. Could you? And I can't remember in the context in which you mentioned it. Can you expand on that a little bit? I don't remember if it was one of the, if you don't vaccinate for one of them.
Yes, so it is the I didn't actually, I'll go back. It is the lepto. Yes, the lepto can cause moon blindness, leptospirosis, and that's the eye disease that some horses get. That basically they kind of go blind at the end of it. So it can cause moon blindness.
Oh, very good. Okay. Yep. Thank you for that.
Yeah, no problem. Any other questions?
Thank you for doing this.
Yeah,
very
no
helpful.
problem. And I'm gonna I will record, or I will add this to our YouTube channel, and then I will also send out the link to everybody.
Perfect.
Yeah. And if you ever need or have any questions, feel free. Here's my contact info. Feel free to call or email me, and I can help you.
Great, thank you.
You're very welcome. Well, good. Well, without any other questions, thank you for joining in tonight.
Thank you.
Mhm.